I'm giving you 7 early warning signs and symptoms of kidney problems and what to do about it. Number 6, low back pain. Now here's the interesting thing. Most of the time, chronic kidney disease does not cause low back pain. It doesn't. But there are cases when low back pain can be a warning symptom of kidney problems. For example, if you have a urinary tract infection that has progressed or ascended up to where you actually have kidney infection or pyelonephritis, that can certainly cause you to have a low back pain, and that's a kidney problem. And also, if you have kidney stones, oh my gosh, kidney stones can cause a low back pain that will make my biggest, roughest, toughest patients fall down to their knees and cry. Yes, low back pain can be caused by kidney stones, which is certainly a kidney problem that you don't want to deal with. Be sure to watch my videos on the painful truth about kidney stones and my video on kidney pain symptoms after you finish watching this video. It is important to remember that even though it is possible for low back pain to be a warning symptom of kidney problem, most of the time, again, you don't get low back pain just because your kidneys aren't functioning well. So it is going to be very important that you follow up with your primary care physician and you get screened before even waiting for a symptom like low back pain. Number 7, urinary tract infections. I get so many patients in my office who have recurrent or repeated urinary tract infections, and this could actually be a warning that there's a kidney problem. So you can get a bladder infection or cystitis. That's a common urinary tract infection. And what happens there most often is that bacteria, or it could be some other pathogen like fungus or even a virus, but usually bacteria crawl up the urine tube or the urethra into the bladder. Now, with women, because the urethra is short, okay, the distance between the bladder and the outside world is short in women, they tend to get this cystitis or urinary tract infections more frequently. With men, because the distance between the bladder and the outside world has to go all the way through the male organ, well, it's harder for bacteria to crawl and make it all the way up to the bladder before a man urinates and gets rid of them. So if you get recurrent urinary tract infections, specifically recurrent kidney infections or pyelonephritis, this could certainly lead to kidney disease. But the recurrent urinary tract infections could also be a warning that there's something else going on with the kidney. For example, you can have blockage. If you are a man and you're constantly getting urinary tract infections, that's not really of the norm. And so you want to make sure you talk to your doctor about perhaps doing a kidney ultrasound or some imaging of the kidneys to make sure you don't have a big prostate that's causing a backup of urine, which is leading to your recurrent urinary tract infections. And also for both men and women, if you're getting recurrent urinary tract infections, that can mean you have some type of a blockage or a tightening or a stricture somewhere in your kidney system, the genital urinary tract. For example, if you have a narrowing in that urethra, that tube from the bladder to the outside world, that can be something that leads to repeated urinary tract infections. So yes, having urinary tract infections could be a warning that you have a kidney problem, and you definitely want to do something about it. So these are some of the early warning signs and symptoms of kidney disease. The list certainly is longer than that, but I want to know this question. Were there any warning signs that I mentioned that you were not previously aware of? Please let me know in the comments. There are many different causes of kidney disease, but it is key to recognize these warning signs and symptoms so that you can act early and prevent a progression to kidney failure. Yes, the number 1 cause of kidney disease is diabetes. The number 2 cause of kidney disease is high blood pressure in the United States. But there are other things as well, things that aren't such common knowledge. For example, certain medications can cause kidney disease. Also, if you get an overwhelming infection or a septic shock, that can lead to kidney disease. Dehydration. Yeah, not drinking enough water can lead to kidney disease. And then there are different genetic diseases, things you're born with, like autosomal dominant polycystic kidney disease or IgA nephropathy or FSG, focal segmental glomerulosclerosis, IgA nephropathy. The list goes on and on. The key to kidney disease prevention is seeing your doctor. Remember, the most common early symptom of kidney failure is nothing. It's nothing. But when you go to your doctor and you get your routine history and physical, again, we do routine testing. We can check for your kidneys to make sure that you're not having kidney problems. And if you are, or if you have a family history of kidney disease, then your physicians can really guide you to prevent progression to kidney failure. I want you to be proactive, okay?